Well, let's have a start. The first talk, I'm honored and very happy that I can be in this webinar on osteotomies. Osteotomies around the knee is the topic, and the basics. I'm going to introduce the participants to the basics of osteotomy. So, what is an osteotomy, and why do we do osteotomies? Osteotomies, it's all about changing the alignment. I'm going to introduce a little bit about the effects of malalignment and the effects of alignment correction. So what is an osteotomy? If you would try to find anything about osteotomy in Wikipedia or any other source, it's kind of surgically cutting a bone, especially to allow realignment. Well, that is kind of accurate, actually. However, the other things you read are hopelessly out of time, very historical, and not very accurate. And it's even kind of dangerous that patients who are Googling on osteotomy are reading this, because it's about general anesthesia, it is about dressing sticks, shoe horns, and all kind of strange information. So there is something we have to change about the information on the internet on osteotomy. But osteotomy as surgical cutting of bone, especially to allow realignment, is kind of accurate. Why do we do osteotomies? Well, we have a very nice list of speakers this afternoon, and we all love this, so we are kind of biased. But osteotomies are very powerful treatments in our hands. And if you're a novice to this treatment, you should really look at what's published, and also, make use of these kind of webinars to find out. Osteotomies can cause instant changes and results, and it's often very dramatic improvement for patients, what we do with osteotomies. It's all about alignment, the shapes of bones, and the joint surface reconstruction, because also in the joints you can do osteotomies, even in post-traumatic salvage procedures. Osteotomy surgery can be performed safe these days. However, you should be aware of the complications, and Matt Dawson will have a fantastic presentation on this topic too. So, as in any kind of surgery, and also if you're listening as a physiotherapist here, be aware of the complications so that you can anticipate on any situation which is out of the ordinary and refer the patient back to the treating surgeon. And of course, the treating surgeon should be aware of complications that can take place. However, these days, with the current instruments, with the current planning techniques, these kind of surgeries can be performed safely. And most important, it works. And many of the speakers will present cases and will tell you about how it works and what the effects of osteotomies are. Now, this book I would recommend for everyone to read. I've been reading it since it came out, and every other chapter is new to me. And I've been around quite long in joint preservation, but there are so many new things in this book, and it represents a lot of the information you can get at the GPC annual Congress. However, it's more than that. So I've been honored to be able to contribute with a chapter on unloading osteotomies around the knee. And I'd like to introduce three definitions that are out of that chapter. So osteotomies is about changing the alignment. You can do an unloading osteotomy to correct the weight-bearing line from the affected side to the other compartment. Well, that's most of the time in the frontal plane, varus valgus. You can do a neutralizing osteotomy to correct the alignment to a neutral mechanical axis. That can be the aim of correction. Neutral axis. For example, as osteotomy in a very damaged post-traumatic knee, just realign to neutral. Then you save a joint. And also for cartilage procedures, if you want to do cartilage reconstructive procedures or anything else like that, it might be worthwhile to do a correction to neutral. And finally, a normalizing osteotomies. sometimes varus is normal in the other leg. The patient doesn't like to have, after an accident with a malunited fracture, doesn't like to have a straight leg, just wants to have symmetric legs. So you correct to symmetry, which may be to valgus or to varus. So normalizing osteotomies and normalizing bone shape may also be what osteotomies is all about. In this chapter, I present this table, which is far from complete, but it includes also pathology, like what do you do with cartilage pathology? Do you do unloading HCOs and DFOs? What do you do with meniscus pathology, ligament pathology, and deformities which are congenital, developmental, post-traumatic, and post-surgery even? And then finally, what do you do with patellar tracking? And in all these cases, you can see what type of osteotomy you can use. Anyhow, back to the topic of today. What is the effect of malalignment? Well, we know osteoarthritis is the biggest population of our patients. Osteoarthritis, if you have a deformity of only 4 degrees, it increases the risk for osteoarthritis progression 3 times, and even 10 to 20 times faster if you have a pre-existing deformity at the time of the OA. So only 3 degrees, think about that. If we know that, we should be aware of the effects of realignment. Malalignment progression also, you have vicious circles. ACL ruptures, very common injury, may lead to medial meniscus rupture, cartilage damage, and then you have malalignment in progression. That's a vicious circle of increasing joint damage. Osteoarthritis as a disease of mechanics, that's one of the principles of alignment correction. If you want to treat the disease, treat the malalignment. And this is all described in the book of Dror Paley, which handles about deformity analysis and planning of correction. The weight-bearing line position, and that will be the topic in many of the other talks today, is key to what you're gonna do with your osteotomy. Weight-bearing line, normal, and correcting it to unload a diseased department is one of the principles of osteotomies, and one of the principles behind it are the mechanical principles. Now, it's not only about the weight-bearing line repositioning, it's also about the joint line position. So, and that will be part of the talk of Christian Klei later on double osteotomies. You can do a realignment of the leg with an unloading osteotomy, but you have to take care of the joint line orientation. Otherwise, if you are not aware of where the deformity is, which means is it in the femur or in the tibia, we're talking about osteotomies around the knee, you can make big mistakes. And if you are making these mistakes and you cause a oblique joint line, which is not normal, you create a new problem. The leg looks like straight, but you have an oblique joint line, and you want to preserve the joint line also kind of horizontal in the ankle as well as the knee. So it's not only about realigning the weight-bearing line, the leg, it's also about retaining the joint line orientation where it should be. And in this case, it's a double level osteotomy to do that. The effects of alignment correction are quite clear, and every other day new studies are published. This is just an overview of some of the studies. Akisuki presents like 10 years and more than 10 years results with very good outcome. Effects of alignment, some surgeons found out, and Rodi Jacob is a very important pioneer in cartilage surgery, that you can concentrate on cartilage reconstructive procedures, but alignment will win. The bone will win. So you can have the most beautiful cartilage procedure. However, if the alignment is off, your cartilage reconstructive procedure will fail because of overloading of that reconstructed cartilage part because of the alignment. And he concluded that in a talk given at the ICRS in 2016. And then he had an historical overview since the beginning of the ICRS. What they did, what he also said, himself did, was focus on the cartilage repair, all the new techniques, but they kind of forgot about the alignment. This is a very important article about the osteochondral defects. It is proven, and there's many more articles on that peak edge loading, so the load around the edges of cartilage defects, can be positively influenced, so to a decrease of the peak edge loading by osteotomies. And that's very important. If you want to treat that osteochondral defect, you need to have an alignment that causes a repair, that causes your repair treatment or your reconstructive treatment to work. And that is all about in the article of Mina and Garrett. This is a bone scan, conventional bone scanning. This is just to show how high tibial osteotomy works. Bone marrow edema at time 0, 12 months after, and 72 months after. And the diseased medial compartment at 72 months is still not irritated anymore, as in a bone marrow edema signal. All kind of other effects of alignment correction have been documented: arthroscopic second look, surgeries by Cuscino, ACI and HTO, and return to sports. Return to sports is also a very important issue in the last 3 to 4 years. And there are many publications that report that after HTO, return to sports is very successful, equal also after distal femoral osteotomy. This is also one of the articles that talks about the effects of alignment correction. And again, alignment is key as a basic principle for osteotomies. This group of experts, Marcus Arnold, Michael Hirschman, and Peter Verdonk, they were talking about young patients with old knees, cartilage trouble in young patients. What do you do with that? And they find out that the highest priority in treatment is, first of all, a balanced mechanical leg axis. Then you look at the ligaments. Third, you look at the meniscus. And then comes a time after these three factors are taken care of for a cartilage repair procedure. That's the right order: mechanical leg axis, ligaments, meniscus, then cartilage repair. And that's also what we refer to, Michael Hirschman and myself, in an editorial at the Kesta Journal in December 2017. Because it's just true, and we have all been there. And if you are longer down the road in treatment of patients with joint preserver treatment, in these cases, if we didn't take care of the leg alignment, it failed. And this was a confirmation some years later of this previous group of expert article, which was also an editorial at the Kesta Journal. Now, to come to a conclusion, and this is just on the basics of osteotomies, and I know about the other speakers' talks of today, so I will not go into all the different topics we can talk about, because they will all be dealt with by the other speakers. The conclusion is, it's all about alignment and realignment, and not only weight-bearing lines, but also joint line orientation. Take care of that. Take home message: incorporate the knowledge of joint preservation in your daily practice to the benefit of your patient, and definitely read this book. Finally, before I thank you for your attention, I'd like to point out a virtual masterclass of the London Knee Osteotomy Group. I'm happily working with other guys there on the 29th and the 30th of April of this year. And with this, I give the mic back